So, hi guys, it's me again. I am 5 weeks, 2 days post-op, and the reason I'm making this 2 days after my 5 week mark is because I went to London today for my final checkup, so I wanted to include that into the update as well. So the good news is, I'm binder free. The surgeon said I can get a shot on my binder now. She said I could basically do what I want with it, so I think I will. So yeah, she's really happy with everything. So yeah, I spoke to her about this being uneven. She then said to me that there's actually still some swelling by here, and she reckons once that goes that it'll drop and stuff. So yeah, I'm quite happy with that. I don't know if this is swelling or if that's meant to be. I don't really know, if I'm honest. But yeah, you know, I'm quite happy. She basically said like that if I wanted this altered, if it bothered me that much, that it would probably leave more scarring than it's worth. So yeah, I guess this is it. You know, she said it's going to take up to a year to see some good results and stuff like that. So yeah, you know, I guess it's not that bad. You know, this one obviously is the one I've been having problems with, but she said that it seems to be doing quite well. Yeah, a little bit scabbing there, a little bit scabbing here. My nipples finally made an appearance. This one's fine. It's my favourite. I love this one. She said, for those who might not know, she said basically if I like, this is gonna look well dodgy, but if I basically massage them like around the edges, it should reduce the scarring. And she basically said to put some E45 on it. So yeah, she said to coat myself in this basically twice a day. Apparently that helps with scarring and reduces it and so on and so on. So yeah, I'm actually quite chuffed with that. Yeah, so you know, what more can I say? Like, I'm literally done. Like, I'm 5 weeks and 2 days post-op and I am done. So yeah, it's been really good. It's been long. Loads of people say, oh, you know, it'll go really fast, but I'm not going to lie, every week really dragged. Really dragged, and it feels like a lifetime ago. It was January the 8th when I was having my surgery. So yeah, I'm just glad it's over and done with. I still can't feel anything in my chest. I can feel sort of here. Yeah. But in the middle, no. Really weird. I did speak to her and ask her when I was going to get the feeling back, and she said maybe a year down the road, maybe never. But I'm really not too bothered by that, to be honest. If it's a sacrifice I had to make to go through this, then you know, I was willing to make that and so much more. So yeah, I'm happy, to say the least. I'm glad it's all done with. I'm glad I can finally go to bed on my side now. She said, what I found weird about it though is that she said that I can go back to the gym now and do weight training and stuff like that, and I was thinking, the day you get discharged from hospital from your surgery, they usually say to you, oh yeah, you can't go to the gym, you can't drive, you can't work, you can't sleep on your side, you can't pick anything up, you can't dance, you can't breathe, you can't walk, you know, it's just like insane, the list of stuff you can't do. And then today she's like, yeah, you're 5 weeks, 2 days post-op, you can go to the gym if you want. And I'm just like, whoa. Don't I need to break this in, or, you know, but she was like, no, you know, you want to go to the gym, then go to the gym. Sorry. Yeah, and I was like, oh, okay, so from nothing to gym, to weight training. So that was a bit weird. But yeah, overall, I'm happy with how things are going. I've put on a stone in weight in the last 4 weeks, so that's really good, because I lost half a stone before surgery, so I'm up half a stone. Hopefully I'll continue putting on weight, and hopefully my muscles will start getting bigger, I hope. But I've got a lot more muscle definition now than I've ever had in my life, if I'm honest. So yeah, my abs and that are looking pretty good, like coming through nicely. Yeah, so I couldn't be happier, if I'm honest. I've got to go back a year this month, roughly, in a year's time, next February, and she wants to have some photos taken and stuff like that, because that'll be when the results are looking much better and healing should have finished by that point. She reckons the swelling will take a couple more months to go down. But other than that, yeah, really, really chuffed. Not sure if I mentioned that. 2 seconds. Can't think of what else to pick up on, really. I'm sure there's a lot more stuff I was meant to talk to you about. I can't really think to save my life. I'm just so, elated with today's news, especially when she said, oh yeah, that binder can go. And I was just like, sweet. So yeah, but if I'm honest, I was ready to go in and be like, it's all uneven, fix me now, and basically bite her head off. Because when I took it off and I was like, go on, tell me that it's a mess and whatever, and she was like, oh, that's really good, that's really, really good, I really like this, blah, blah, and I was like, as camp as I am, I was just like, oh, stop it, stop, I know, I look good, yeah, thank you. She basically said, if you stop looking at your chest for about 2 months, then you probably won't notice how uneven they are, and I was like, I'm not sure if you're aware, I've just had surgery. You want me to stop looking at my chest for 2 months? That's probably not going to happen, really, is it? Ever. So, even though I might notice how uneven they are, she reckons, other people won't notice, and I guess I don't like that bad today, actually. When I was filming this last week, it was like, oh my god, they're like a metre apart, and so dramatic sometimes, but, yeah, actually looking at it now, well, these lines are here are part of the swelling. I don't really know what's going on with that, but I think I'm trying to learn how to move my pecs individually. I'm not really I'm not really having much luck. But yeah, all in all, it's nice to feel the t-shirt on my skin. It's the most surreal feeling ever. And another thing the surgeon said today, she was like, you can go back to doing whatever, this, that and the other, swimming if you like. And I thought, swimming? So I haven't been in a leisure centre for 11 years. 11 years. Pretty much since I started growing boobs, I haven't been in a leisure centre for. So yeah, that's nuts, like nuts. So yeah, it's going to be on my things to do when the weather brightens up, which, as you can see, it ain't really all that bright at the minute. So yeah, all in all, I'm pretty happy. I'm just glad it's all done. A lot of people have been saying that they've noticed how genuine my smile is now. To be honest, I didn't really notice that I wasn't smiling genuinely before, but obviously now being a lot happier, I guess it just shines through a lot more. There's not so much pain behind the smile. But yeah, I'm just truly speechless. Like when I walked out of that hospital today, I just had the biggest grin on my face, and Kellen's just looking at me like, "You're right there." I was like, "Yeah." But yeah, I just things are just good. They're really good. Just amazing. I'm just probably pissing you off now with how happy I am. But yeah, so this is it. This is my 5-week, 2-day post-op video. I was going to make one next Wednesday for my 6 weeks post-op, because that was when I was expecting to get my binder off. But now I'm not sure if I'm going to. I don't know. I think it depends if there's any dramatic changes, like the scabbing comes away or anything like that, or I do decide to go back to the gym this week, which I'm not 100% on yet, because I still do feel a bit fragile. Then I'll update you. But other than that, you know the drill. You need me, call me, Facebook me, message me, YouTube, anything, and I'll get back to you as soon as I can, which is usually pretty quick. And yeah, just to let you know, if you haven't watched any previous videos, I had my surgery with Miss Catherine Milroy in the New Victoria Hospital in London. So, just so you know, she's a really good surgeon. She's really witty and just a very outgoing person. She makes you feel comfortable and at ease with everything, and she fully explains what she's about to do. I can't say so much for the doctors and the doctors and nurses and the people I seen after her, because they were crap. But yeah, she is pretty damn good, and like today, she was just honest and out with it, and basically said, if you want another surgery, you're probably going to ruin yourself. So I appreciate her honesty. as gutting as it is, but like I said, looking at them now, they don't really look that uneven, so I guess I can live with it. It's better than having boobs, by a long shot. So yeah, really happy, and I'm going to leave you go now before I really irritate you all. But thanks for watching, and I might see you next week, I might not, but either way I will update soon. Okay, bye guys.